Eating disorders and nutritional therapy. Eating disorders, which are chronic illnesses that require long-term treatment, are mental illnesses, although physical symptoms come to the fore. Eating disorders, which result from disordered eating behavior and thoughts and feelings related to food, are often seen along with other mental illnesses such as substance abuse, depression, and anxiety disorder. To understand the content of eating disorders and nutritional therapy, first of all, it is necessary to learn about the types of eating disorders. According to the criteria published by the American Psychiatric Association in 2013, there are 4 types of eating disorders. These are anorexia nervosa, bulimia nervosa, binge eating disorder, and unclassified eating disorders. The main features of the individual are to see himself as fat, to be accompanied by uncontrollable emotional turmoil in real life, to be accompanied by eating, to be afraid of being fat, to have a strong desire to lose weight, to own it. Physical appearance disorders. Although it appears to affect teenage girls and young women in general, people of all ages and genders can suffer from eating disorders. Chronic eating disorders in men have nearly doubled in the past decade, although their incidence is still higher in women. Eating disorders lead to serious health problems, even death. It is a mental illness with a very high morbidity rate. The reasons for its formation are still unknown, but it is believed that biological and psychological causes play a role at the same time. Eating disorders are associated with problems such as depression, low self-esteem, family problems, identity confusion, and feelings of worthlessness. It can be seen as an attempt to bring an external solution to the internal turmoil. Eating disorders and nutrition therapy. This requires working closely with patients. Anorexia nervosa. Anorexia nervosa, who are dangerously underweight but continue to feel fat, see themselves above their desired weight every time they look in the mirror. They are very afraid of obesity and gaining weight. They are often critical of perfectionism, but have low self-confidence. They don't admit they have an eating disorder in the early stages of the disease, but weight control has become an obsession for them. Patients develop different weight loss behaviors, with most losing weight by reducing or decreasing food intake. Some patients do heavy exercises. In many cases, patients experience panic, anxiety, substance abuse, and obsessive-compulsive disorders along with anorexia nervosa. Over time, serious health problems such as miscarriage due to excessive weight loss, bone fractures due to calcium deficiency, dry and jaundiced skin, excessive constipation, and cardiovascular disorders occur. In order to apply the treatment of eating and nutrition disorders to patients with anorexia nervosa, patients must receive treatment in order to distinguish and understand the thoughts, feelings, and behaviors that trigger the fear of obesity. Medications, psychotherapy, and nutritional counseling have been found to be effective in treating anorexia nervosa. Bulimia nervosa. Patients with bulimia nervosa consume a lot of calories with frequent eating bouts. After that, they throw the food they eat out of the body by vomiting or with the help of laxatives and diuretics. During binge eating, patients often feel out of control. After the seizure is over, they practice one or more of their behaviors such as fasting, using laxatives or diuretics, making themselves vomit, and exercising excessively to compensate for this behavior. Because of embarrassment or disgust, bulimics practice these behaviors alone and in secret. Patients vomiting after every eating bout or after every normal meal can also cause medical problems. Constant redness and sore throat, swelling of the face and cheeks to look like a squirrel, stomach valve problems due to constant vomiting and reflux, dissolving tooth enamel and tooth decay due to constant contact with stomach acids, bowel problems due to excessive use of laxatives, kidney problems due to excessive use of diuretics, and problems with fluid loss are other medical problems that bulimia nervosa suffer from. While applying eating disorders and nutritional therapy to bulimia nervosa patients should receive psychotherapy with medications. Patients often do not believe they need treatment and need persuasion. Through general nutritional education and nutritional counseling, the patient regains regular eating habits, and this treatment has been shown to be effective in treating bulimia nervosa. Binge eating disorder. The first part of this disease is very similar to bulimia nervosa. Patients consume a lot of calories with frequent eating episodes and feel out of control during these attacks. Unlike bulimia nervosa, patients with binge eating disorder do not resort to behaviors such as making themselves vomit, stuff, exercise excessively, or use laxatives to compensate for this behavior. The embarrassment, self-disgust, guilt, and distress caused by overeating lead to the same cycle again. As a result, patients with binge eating disorder are slightly over or above normal weight and are obese. These patients are at particular risk of developing cardiovascular disease and hypertension. Treating eating disorders. Eating disorders and nutrition therapy begins under the leadership of psychiatrists. In most eating disorders, patients do not accept that they are sick, and this affects the management of treatments in response to treatment. Therefore, patients must be persuaded to treat. In eating disorders, which have serious consequences that can lead to death even in the presence of mental illnesses, drug treatment, which begins under the supervision of psychiatrists, is carried out in cooperation with other medical branches such as obstetrics, cardiology, and internal medicine. One treatment approach does not benefit the patient. All patients are different from each other, so the treatment must be appropriate for the patient. There is no definitive drug treatment for eating disorders, and medications are more beneficial and are used to treat physical symptoms. Medications should be administered in conjunction with psychotherapy. Eating disorders and nutritional therapy require psychological treatment. Psychotherapy is indispensable in the treatment of eating disorders. It plays a huge role in the correct participation of patients' families in treatment, and the cooperation of families and patient support is of great importance in treatment. Some severe cases of eating disorders require hospitalization. Hospitalization is the most appropriate form of treatment for a patient in situations such as rapid and excessive weight loss, inability to stop vomiting, presence of most of the medical problems listed above, and failure of previous non-hospital treatments. If the medical problems and weight loss are too high, the patient is first admitted to the internal medicine clinic with observation and follow-up by psychiatrists. After the patient's medical condition improves, he is transferred to the psychiatric clinic. In order to finish inpatient treatment, the patient must learn healthy eating habits again, approach a healthy weight, medical problems must go away, and vomiting and use of laxatives must be controlled. After these criteria are met, the outpatient treatment can be continued with the patient again. It is difficult to predict the duration of inpatient treatment during the treatment of eating and nutritional disorders, as these treatments make up only a small part of the actual treatment. Continuing outpatient treatment is the largest part. During outpatient treatment, the patient should be constantly monitored for a long time and ensure that he does not return to his old, unhealthy habits. Individual or group psychological therapies continue throughout the process.